Okay, so while assessing mandibular motion in supine, we are going to check for joint noise. Joint noises include things such as a click or crepitus. A click is a sudden explosive noise that represents the sudden distraction of two wet surfaces. This could be symptomatic of disc displacement. The differential diagnosis and treatment of this would depend on whether or not the click is left, right, bilateral, whether or not it was painful or non-painful or consistent and intermittent. The patient may have condylar hypermobility, enlargement of lateral condylar poles, or structural irregularities of the eminence. The timing is also going to be significant. A later click may equal a greater degree of joint displacement. Clicks can be felt or heard, but it is important to note that only 30 to 40% of patients that experience clicking have no pathology. Another thing that we might hear while we're doing this is crepitus. This is caused by the articulatory surfaces of the joint being worn. The most common people you'll find this in are patients with degenerative joint disease. This is when you might want to use a stethoscope. So what I'm going to have my patient do is go ahead and lay flat on his back. Here we go. So upon opening, the first 20 millimeters is rotation in an anterior direction. The remainder is going to be the translation of the condyle in an anterior-inferior direction over the articular tubercle of the temporal bone. The translation period is when you're going to hear the clicking. So you would put on some gloves. I have my patient laying supine with no pillow. You could also use a very flat pillow for patient comfort, but you don't want to change the way the joint is positioned. And then you would place your fingers and palpate right over the joint. And then have your patient slowly open, listening and feeling for any clicks or crepitus. And go ahead and relax back down. So when you're palpating as the joint's opening, you should feel the condyles move posteriorly on your fingers. With Gary here, go ahead and open slowly. I don't hear any popping. I don't feel any kind of popping. Go ahead and relax. But if I was concerned that I might have felt something, or if I was concerned for crepitus, I could take my stethoscope and place it diaphragm side right over the joint, and then repeat. Go ahead and open slowly. And back. And here I'm just listening for a click or any kind of crepitus.